First at 5, we're learning some of West Michigan's biggest health systems will not follow the new mammogram guidelines laid out today by the American Cancer Society. The guidelines suggest for most women, less screening may be more beneficial. They recommend annual breast cancer screenings at age 45 instead of 40 and switching to every other year at age 55.
If she starts screening at the age of 40, she increases dramatically the lifetime risk that she's going to have a false positive result, that she's going to need a breast biopsy that turns out with the doctor saying, well, you don't have cancer, sorry, we'll put you through all of this.
But Spectrum Health and Mercy Health St. Mary's say they will not follow the American Cancer Society's recommendations. While officials at Metro Hospital tell us the guidelines will be part of the discussion with a patient and their doctor. I'm joined right now in studio with Dr. Thomas Getz, the medical director at Spectrum Health Betty Ford Breast Care Services. Thank you so much for joining us.
My pleasure.
Were you surprised to hear about these new recommendations?
Well, I think they're trying to walk a middle ground between the U.S. Preventative Service Task Force guidelines, which are actually just draft guidelines that came out earlier, and their prior guidelines. And what they're actually saying is not that women shouldn't have screening mammography at 40, but they've stratified it into several tiers. So they have a qualified recommendation that women that want to start screening at 40 annually should be allowed to, and then they have a strong recommendation that women from 45 to 54 should have annual mammograms, and then a qualified recommendation again that at 55 it may be okay to drop down to every other year, but then they still also say that if a woman still wants to have annual mammograms at 55, they should be allowed to do so. So I think that may lead to some confusion.
Now this differs in the task force findings of how to proceed with testing for breast cancer.
Right. The task force had said not to start until age 50 and then only perform screening every 2 years.
And that leaves you those 10 years from 40 to 50 without any screening.
Right.
But, so this is better.
We find that some of the faster growing cancers are in the younger patients. And so we think it's really a shame not to start screening at 40 because that's where we can sometimes have the most benefit.
I think this can be confusing to women. Why are we going back and forth with the recommendations?
Well, what the American Cancer Society is doing, and I think that's a good thing, is to balance the risks of screening versus the benefits of screening. So in their own data, they show that the incidence of breast cancer increases pretty strikingly starting at age 40, and they show that the best way to save the most lives is to start annual screening mammography at age 40. But they're also concerned about the people who don't have breast cancer who are called in for additional testing, such as for a diagnostic mammogram or for a biopsy. And we know that of all the women who have screening mammograms, about 10% will have a subtle, possible early thing that prompts us to bring them back for additional views or an ultrasound. About 80% of those women were able to quickly reassure and tell them that everything is fine. But about 20% will need to go on and have a biopsy, but that's only 2% of the screening population.
So Spectrum isn't going with these recommendations anyway. They're going to increase the patient discussion and have more testing anyway.
Right. I think patient discussion is always a good thing, and I think it's good for patients to engage with their doctors about what's appropriate for them. But we still think that we can save the most lives by starting screening annually at age 40. And so we're staying with the recommendations of the American College of Radiology, American College of Surgeons, and the Society of Breast Imaging, which is every year starting at 40.
Quickly, what do you recommend women do that may be confused about these recommendations coming out?
Well, there are a couple of good websites with a lot of information. There's www.stoptheconfusion.com, which has a lot of good written information, and then there's www.mammographysaveslives.com, which has a lot of good teaching videos.
Okay, so that's certainly a direction that women can go in, but you're saying start the testing every year at age 40.
We still think so. When we find big cancers, almost always when we look back, the patient has not had a mammogram the prior year or the prior 2 years, and that's just a shame that we're missing an opportunity to catch something at a curable stage.
Right, got to get it early. That's
Absolutely.
the thing. Dr. Getz, thank you so much for joining us. We appreciate your time.
Glad to help.